All the witnesses giving their testimony, we'll move into questions and answers, and I will recognize myself for the first 5 minutes of questions. Dr. Tabak, I, along with now chairs Rogers and Guthrie, have sent the NIH 14 letters requesting information. Those letters ranged in date from March 18, 2021 to November 30th, 2022, and most have gone completely unanswered. We received responses from other agencies, such as the CDC, to our letters. It appears there was a standing policy at the NIH to disregard letters from the minority members of this committee. Is that true? Yes or no?
No.
So it's just incompetence that caused 14 letters to go basically unanswered. I'll take that as given. We sent you a letter on February 2nd last week requesting documents and information from the NIH related to the COVID origins and the EcoHealth Alliance grant to support our legislative efforts on pandemic preparedness and NIH grant management. NIH sent us over 580 pages of documents last night after the close of business and shortly before the President's State of the Union address. That consisted mostly of repeat documents already given out or made public. That's not true cooperation. So I ask you, is the NIH going to fully cooperate with our requests?
We will continue to cooperate fully.
You will cooperate on this request. Thank you. We sent the NIH a letter on November 30th, 2022, asking you not to destroy evidence related to COVID. Last week, we sent another letter asking that you, quote, take all reasonable steps to prevent the destruction or alteration, whether intentionally or negligently, of all documents, communications, and other information, including electronic information and metadata, that are or may be responsive to this congressional inquiry, end quote. Will you vow to follow this request and not destroy these vital records, yes or no?
Yes.
Thank you. Even though the NIH suspended EcoHealth's grants in July of 2020, before our COVID-19 inquiries began over grant noncompliance concerns, and later that it was found that EcoHealth did not follow important grant terms, the NIH subsequently gave a new grant to EcoHealth in September of 2022. Why would you allow a company who breached their contract with the NIH and failed to comply with some important reporting requirements to get more of the American taxpayer dollars?
We follow a process. They were put under advisement of these deficiencies. They have been working with us to correct them, and that's why we proceeded.
But they can't correct the information that they didn't require their partners at the Wuhan lab to give them, to give you 3 years later. So we don't have the information that we learned last week was important in determining both the origins and how to treat those origins at an early date. They failed in a major respect. How can that possibly now comply with your processes?
And we have corrected with them their administrative shortfalls and continue to work with them. We are unable to disbar an organization.
So do you want authority from Congress to be able to disbar an organization that breaches their contract and fails to get us information from a subcontractor that may have had vital information in helping us to respond to the COVID-19 outbreak?
The shortcomings of the Wuhan Institute of Virology have been noted in the GAO report, as you know.
I know.
And they recommend that disbarment be considered. And this is something that, we will...
Do you need new authority from us to disbar?
We do not disbar that. The disbarment official sits in HHS.
All right. Should we add financial penalties to NIH contractors to ensure stricter compliance if they fail to meet their contractual obligations and to fail to give you vital records? Do they need a financial incentive that's a negative incentive?
We can't put such incentives, if you will, or disincentives in our terms of conditions.
You can or cannot?
We can.
You can. I suggest you do so. Should we add financial penalties to the NIH if they fail to do oversight on important research being done with the American taxpayer dollars?
I can't speak to that.
All right. Dr. Tabak, from 2015 to 2019, EcoHealth Alliance gave NIH the grantee for coronavirus research, gave multiple subaward transactions to Wuhan Institute of Virology. EcoHealth has serious deficiencies, as we've discussed. The Office of the Inspector General even confirmed this in a recent report. How do you allow that to happen without consequences?
So the consequences were the initial suspension, reinstatement, suspension of the grant, and we have worked with the primary grantee, EcoHealth Alliance, to get them back into proper order.
It does not seem sufficient to this member. I yield back to myself and